Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to try and make a better system. Today we're going to talk about proposed changes to Medicare and Medicaid. Before we do, down below in the YouTube description box is a link to the Healthcare Advocacy newsletter. It has the text for today's talk. You can sign up for free. All of the actions and reference material that I mentioned are there. Okay, so changes to Medicare and Medicaid are being considered, and bad news, they could cause thousands of deaths. This is according to an article that was published on May 17th, 2024 in the Journal of the American Medical Association online. Some policymakers have suggested increasing the eligibility age for Medicare and implementing work requirements for Medicaid coverage to reduce U.S. healthcare costs. But a recent analysis involving data projections from the Census Bureau suggests that proposed changes would cost thousands of lives without saving the government nearly as much money as they expect. Raising Medicare eligibility from 65 to 67 was linked with more than 17,000 additional deaths over a 6-year period. That was the implementation period, 6 years. The researchers also found that the federal government would save about $890,000 per life lost. Well, that sounds good, except that each life lost for policy decisions, they use a $12.5 million value when you make policy decisions. So it's even less than that. You're not saving nearly as much as you should be. In addition, ending continuous enrollment for Medicaid and requiring people to work to be eligible for coverage was tied to more than 8,000 additional lives lost, again, over a 6-year period. Those would typically be people 65 and under who would probably become uninsured. Part of the problem, as you may recall, is that detection of serious illnesses like cancer occur at 65. The reason is that at that age, many seniors are finally eligible for medical coverage, so they actually go to the doctor and get checked out. Delaying going to the doctor will actually kill many of those who do not go. If you enjoy specifics, I can give you some extra detail, but we'll put it in the newsletter. It is lots of details about the study and who gets cancer and when. I also want to point out that the amount that's proposed to be saved, if you multiply those 25,000 people times $890,000, you get about $22.25 billion. That's over a 6-year period. Now just hold that thought for a minute. Single-payer universal health care like H.R. 3421 offers a minimum $400 billion of savings each and every year starting in year 1, according to the Congressional Budget Office. And the reason is that it cuts down the overhead in the healthcare system so dramatically. And of course, everyone gets covered. So it's far better than $22.25 billion over 6 years. It's $400 billion every year. And those 25,000 people, they would have been able to go to the doctor all along and probably wouldn't have died. So I haven't discussed much about Medicaid yet, but you may recall that an article I wrote a while ago talked about what happens with Medicaid and work requirements. It turns out that very few people actually go to work when you demand Medicaid eligibility tied to work requirements. The state of Georgia is in the process of trying that right now. And what they found, instead of the 400,000 or 500,000 additional people who could be eligible if they would really expand Medicaid to, instead of just adding a work requirement, they added, it was just a few hundred over 6 months, or it might have been up to 2,000. But that's instead of the 500,000 they could have added. It was craziness. Anyway, overall, the other thing that study I was mentioning found was that if people have health care, those that are marginally able to get to work, they go. And so it's actually better for the population as a whole when we have health care that serves everyone. So the answer is clear. Mean-spirited tropes of denying medical care to the elderly, and to the poor only result in misery and death, and they don't result in significant savings. Single-payer universal health care costs way less, covers everybody, and it puts an end to medical deserts by using global budgets. Let's remind people who can do something about it. So here's today's action. It's really easy. You can contact the President, members of Congress, and senators and let them know that this recent analysis of delaying Medicare to 67 and forcing work requirements on Medicaid recipients results in 25,000 premature deaths and offers meager savings. Real savings of lives and money come from single-payer universal health insurance. I'll put a link in so you can contact all those people if you want to get on the phone or email them. Or you can do it the easy way. Use RESISTBOT on your cell phone. All you have to do is send a text message to 50409, and here's the message. Sign, S-I-G-N, space, P-V-O-L-L-O. That's sign, P-V-O-L-L-O to 50409. And that's the message you'll send them. In addition, in that email that they'll get will be links to the studies so that they can have people on their staff read it and see what kind of garbage they have. Okay, universal health care, not raising Medicare eligibility, not forcing work requirement on Medicaid people. That's the real answer. Okay, down below, you can like, share, and subscribe. You can subscribe for free to the Healthcare Advocacy newsletter. There's no charge for that puppy. Leave a comment, send me an email, send me questions or things you want researched. You can also send them to healthcareadvocacy1@gmail.com. That's all one word. Have a good evening.